It's Monday, March 9. This is the news on PBCJ. I am Simone Absalom. Health and Wellness Minister Dr. Christopher Tufton says the country has a COVID-19 comprehensive response plan, which has received the approval of the Prime Minister Andrew Holness's led National Disaster Risk Management Council.
This plan, which is to cost us just under $2 billion, is to do the following: guide the direction, coordination, and management of the health response, support emergency response agencies in the implementation of the national plan, monitor and evaluate key actions in public health to ensure their effectiveness and efficiency in achieving the stated strategic goals of the government to delay, detect, contain, manage, and communicate for COVID-19. As well as to mobilize the needed resources to ensure the comprehensive implementation of key actions needed to realize the goals of the plan.
Dr. Tufton gave some projections on a possible outbreak in the island and what the planned response from the government would be.
Here is what we project for the coming months if COVID-19 visits our shores and if we have community transmission, based on our experiences with H1N1 in 2009. About 2.6 million acute respiratory cases, up from 1 million or so usually experienced on the island each year. These are persons who will become ill, although most will have mild symptoms. Of the 2.6 million, some 800,000 will seek medical care in public and private facilities. At the height of the outbreak, we could see as much as 35,000 or so people seeking care within a given week. Close to 50% of the more than 800,000 persons we expect to access care in our public health facilities. At the height of the outbreak, we could see approximately 16,000 persons in a week. Further, just about 2,000 of the cases visiting public health facilities we anticipate will experience severe acute respiratory infection requiring hospital care. And of this number, some 360 will require critical care.
Dr. Tufton gave a national broadcast on Sunday to address concerns over COVID-19.
We have planned for these eventualities with our main activities, including the following: coordinating, including collaboration across government and with other key stakeholders, surveillance, including imposition of travel restrictions now on 5 countries, case management, including treatment, readiness of health facilities, monitoring of supplies, laboratory response, including training to enable local capacity for testing for the virus, sensitization of healthcare workers, public education, and communication.
Prime Minister Andrew Holness says the government will continue to improve the bureaucratic culture to facilitate investments. He was speaking at the recent groundbreaking ceremony of the Sugarcane Bay Resort in St. Anne.
Seen as a general commentary about Jamaica's bureaucracy is that it does take a long time to perfect the bureaucracy, to bring the permitting and the approvals and fulfilling all the requirements of the law. But once you're in, you're solid, you're on a very solid institutional foundation.
Mr. Holness assured investors that the island has an environment of certainty and remains committed to the ease of doing business and establishing a facilitatory environment while adhering to the proper systems and protocols.
So your investment will be secured. It will be secured from a legal perspective. Our judicial system is very strong and resolves commercial disputes appropriately. We have a very strong economic policy that has withstood 2 legs of a relay now, and in fact I would say that it is now the established policy regardless of government, fiscal discipline. So you can be certain that whatever you invest here will not be at the mercy of whimsical tax policy or other forms of regulations that could deplete or ruin your business. That is not the case in Jamaica. When you invest, your investment is safe and certain. We're doing much better these days in improving our safety and security architecture.
Transport Minister Robert Montague says instead of using gas stations, the parking lots of malls and other properties, transport operators should use the spaces in town centers which have been provided for them at the expense of millions of taxpayers' money. He added that there must be a balance in the system as all operators will not get the exact type of parking amenities they desire. He was speaking to the Jamaica Observer against the background of criticism that taxis have overrun gas stations using them as stands because of inadequate parking in town centers. The public discussion rose against safety concerns for gas stations following a major fire at the Fesco gas station in Mandeville, Manchester recently. Following the fire, the Jamaica Gasoline Retailers Association pointed to long-standing concerns that the forecourt of service stations are being used for all and sundry activities, which creates confusion at the locations, thereby posing a safety threat. The Trelawny School Garden Feeding Program has been launched, and it aims to demonstrate good agricultural practices to students, particularly in the area of climate-smart agriculture. The launch was held at the Wakefield Primary and Infant School, which is one of the 2 institutions in the parish where the project is being initially rolled out, the other being Waitebit Primary School. It is anticipated that the initiative will help to reduce absenteeism and tardiness among students, thereby improving literacy and numeracy levels at the different institutions. The program will shortly also be rolled out at Troy Primary School, Hastings Primary School, Perth Town Academy, Albert Town High School and Mushat High School in Trelawny. All of the institutions will receive donations of farming tools as part of inputs being provided for the engagement. Children should be taught about proper garbage disposal practices as part of their civic roles in keeping their communities clean. That suggestion from Regional Operations Manager for the National Solid Waste Management Authority, the NSWMA, Garnet Edmondson. Edmondson was speaking at a town hall meeting in Norwood, St. James last week to sensitize residents about the preparatory steps that should be taken as the nation prepares to tackle the COVID-19 virus should it come to Jamaica, as well as the ongoing efforts to curtail the spread of dengue. Former Custos of St. Andrew, Reverend Dr. Carmen Stewart OD, passed away on Sunday. In a Facebook post, Prime Minister Andrew Holness said, quote, "Reverend Dr. Stewart was an outstanding Jamaican who dedicated most of her life in service to the church and communities," end quote. Members of the media fraternity are experiencing great sadness at the passing of respected photographer Bryan Cummings, who up to the time of his passing was photo editor at the Jamaica Observer newspaper. Mr. Cummings died on Friday at age 56. He had been ailing for some time. The Press Association of Jamaica's president, George Davis, responding to his passing, said the media profession had lost a great storyteller who spoke through his lens. Minister of Sport Olivia Grange, in paying tribute, recalled that Mr. Cummings was blessed with an eye that all great photographers possess. Sunday was celebrated as International Women's Day, and the women on staff at the office of the Prime Minister got a special tribute. Prime Minister Andrew Holness visited the various departments and delivered roses and a personal thank you to the female staff for their hard work and invaluable contribution to the operations of the office.
Happy Women's Day. Happy Women's Day. And let me see if I find a rose that matches. I find a rose that matches your smile. Okay. Happy Women's Day. Happy Women's Day. Happy Women's Day. Don't everyone? Happy International Women's Day.
Thank you.
Not your day today.
Oh my God.
How are you?
I am really good now.
Happy International Women's Day when it comes. Happy International Women's Day.
Thank you.
So we, the canteen staff, really appreciate this, and I'm glad that they took the time out to come here to recognize us for International Women's Day.
I have a lovely rose for you.
Wow!
I'm going to feel someone for me.
The US dollar on Friday, March 6 ended trading at $135.54, down by 5 cents, according to the Bank of Jamaica's daily exchange trading summary. The Canadian dollar ended trading at $101.52, down from $102.54, while the British pound sterling ended trading at $175.61, up from $174.75. In regional news, the Pan American Health Organization has made a fervent appeal to the Americas, including the Caribbean, to prepare to respond to imported cases, outbreaks, and community transmission of the novel coronavirus COVID-19. On Friday, PAHO said that in at least 10 days, 14 countries in Latin America and the Caribbean have reported confirmed cases of COVID-19, in addition to the United States and Canada. Given the rapid arrival of COVID-19, PAHO urged countries to focus on containing the virus, saving lives, by ensuring that health workers are protected and that the sector is prepared to care for patients, and reducing transmission through multisectoral actions and measures. PAHO said that as of Friday afternoon, 257 cases were confirmed in 10 countries and 4 territories in the region of the Americas, namely Argentina, Brazil, Canada, Chile, Colombia, Costa Rica, Dominican Republic, Ecuador, French Guyana, Martinique, Mexico, San Bartolome, St. Martin, and the United States. The Anglican Church in Barbados is advising members to avoid direct contact with fellow members as precautionary measure amidst the looming threat of COVID-19. More in this report from Barbados Today.
Anglicans are being advised to avoid direct contact with fellow members as the church implements measures to safeguard its congregation amid the growing concerns about the coronavirus. Communion practices have also been altered, while the traditional sign of the peace, where worshippers hug, kiss, or shake hands, have also been suspended. The Diocesan Synod of Barbados said a nod, smile, or bow will suffice in the meantime. Rector of the St. Barnabas Anglican Church, Reverend Mark Haywood, informed the congregation of the new measures yesterday.
Holy Communion should be administered in one kind only, on the species of bread, and placed onto the hands of the recipient only, and not onto the tongue. Our teaching is that Jesus Christ is received in the bread, just as in the bread and wine. Only the celebrant should drink from the chalice. Intention is not to be done at this time. 4. Suspend direct physical contact as part of the blessing or laying on of hands. 5. The Church's duties of care extends to the members of the clergy. Kindly advise the faithful if they have influenza-type symptoms, they should not call the clergy for pastoral visitation. Pastoral support for parishioners who are unable to attend church services should be provided by telephone or social media. 6. Parishioners who fell ill and display influenza-like symptoms should stay home.
Churchgoers have welcomed the measures.
I agree with safety. I felt a bit awkward to be at church for the first time, but I understand what they're doing and I'm all for it.
I think in the interest of the whole coronavirus, that I don't think it takes away from the service. I don't think it away from people being happy to see each other. I think it is just a precautionary measure for now, and hopefully that once the virus is no more threat, then we can hug and kiss and so on. But I don't think that it is here yet, so We still kind of lucky, but I don't have a problem with they say cleanliness is next to godliness. So if the whole thing about reducing the transmission of the virus for now, I'm all for it.
It's okay with me because you can't take any chances these days. So I agree with the changes. You just gotta live with them. It's all right.
I really don't have any concerns about it, but I think the good thing about it is that you're trying to prevent any spread of the disease altogether, which is a good thing.
I guess it's good in terms of prevention and to be proactive. I guess it's a good move.
You support it?
Yeah, I support it.
Meantime, the Ministry of Education says it's taking no chances with the safety of staff or students at public institutions amid the coronavirus fears. Speaking with reporters after Sunday's church service at the St. Barnabas Anglican Church, Minister Santia Bradshaw said education officials were being treated with the same caution as frontline public servants at the island's ports of entry.
We have recently been in discussions within the ministry about our PSAs, our public service announcements to the general public and in particular within the schools, because quite recently we would have had a session with the Ministry of Health and the frontline workers, and we believe that just like the persons at the airport are treated as the frontline workers and the ports of entry, similarly our teachers or administrators interfacing with students themselves also become frontline workers as well. And therefore it is important that we engage them in discussions as to what are the signs that they must look for, what are the response mechanisms that must be in place in order to address students who they suspect may come to school and may present with these particular types of symptoms as well. So the ministry is involved in a committee with the other respective ministries that would have to weigh in on this issue.
Over in Guyana, Acting Chief Justice Roxanne George Wiltshire on Sunday ruled that the High Court has jurisdiction over an injunction filed by the supporter of the main opposition People's Progressive Party, Civic, as Guyana awaits the outcome of last Monday's regional and general elections. Last Thursday, Justice Narvinder Singh granted an injunction against the Guyana Elections Commission, the Chief Election Officer, Keith Lowenfield, and returning officer for Region 4, Claremont Mingo, after the application had been filed by Reyes Hollander. PPPC had earlier secured an injunction to block GCOM from declaring the results for the election on the grounds that the votes declared for Region 4 were not completely verified. In related news, protests erupted across sections of Guyana on Friday as supporters of the opposition People's Progressive Party Civic contested the results from Region 4 in last Monday's regional and general elections. News source Guyana's Gordon Mosley reports.
Supporters of the People's Progressive Party launched protests against the Region 4 election results in several parts of the country today, in the Berbice region and along the east coast and east bank of the Marara. The protesters want a verification process to restart. In some areas, fire was set to logs, tires, and other pieces of debris. In Berbice, 4 school children had to be taken to the Fort Wellington Hospital with injuries after a group of protesters attacked the school bus that they were traveling in through Bad Settlement. Since early this morning, the protesters, who are supporters of the PPP, have been protesting against the elections and the declaration of the Region 4 results. A short video recording of the attack on the school bus taken from inside the bus showed the children running for cover as the protesters started to pelt objects at it, smashing the back windscreen. The Region 5 RDC, in a statement on its Facebook page, confirmed that 4 children were injured and taken to the hospital. News source understands that they have since been released. The David G. school bus is part of the President's public transportation system for school children. The buses are in several regions and provide free daily transportation to and from school for the children. Closer to Georgetown, protesters also gathered at Lusignan, blocking the main roadway and setting tires and other objects on fire. PPP candidate and executive member attorney Anil Nandlal rushed down to the area and asked the protesters to keep the peace. He said that PPP was handling the matter and he is confident that the party will triumph. He encouraged the protesters not to block the roadway and to get back to their homes.
I ask you to continue to be vigilant, continue to be mobilized. But my appeal to you here today is to remain calm. I am asking asking you if you can remove from the roadway, please. Let us go. Where we gonna go? Where we gonna go? Where we gonna go?
And this evening, the People's Progressive Party is calling on its supporters to remain calm and act in a peaceful manner. That call came hours after the party supporters started their protest action. In its statement, which was issued this afternoon, the PPP said that while it understands the hurt, frustration and fear of the supporters over the alleged electoral fraud, the party has the solidarity of the international community. The PPP in its statement to the supporters said the international community has made it clear that the elections cannot be credibly declared and there can be no swearing in of a president at this time. The PPP statement addressed its position on the need for the verification process to continue. It is encouraging its supporters not to let any of their actions be in contradiction of the law. It wants its supporters to stay home.
Trinidad and Tobago has one of the highest rates of diabetes-related deaths in the world. Medical researcher Dr. Laverne Scott says the statistic should be a wake-up call for everyone.
Diabetes mortality, 123.3 persons per 100,000, surpassed only by Fiji and Mauritius. So any means of improving diabetes, new drugs, is very much welcomed by the doctors in Trinidad who look after diabetic patients.
Dr. Scott was speaking recently at the launch of PAHO, a treatment said to improve the living conditions of persons living with diabetes 1 and 2. She said in light of the coronavirus threat, diabetics need to take extra precaution.
Diabetes paralyzes the immune system. Diabetics don't do well with infections, and in fact they're one of the high-risk groups that it is recommended on a yearly basis for them to get a flu shot. And definitely having exposure to the coronavirus doesn't increase the uptake of, makes them more susceptible to get the infection, but when they are infected, like anyone else exposed to it, their ability to overcome the infection is less than a non-diabetic.
In sports, we're out on the blocks with athletics as reigning CARIFTA Games champion Shaquina Foote of Petersfield High and Excelsior School's Devontae Archer produced World Under-20 leading times and personal bests to win their respective 400-meter hurdles titles on the final day of the CARIFTA trials at National Stadium. After placing third in the 400 meters final on Saturday, in which she was also the defending champion, Foote produced a sublime run and clocked 57.60 seconds to beat Hydel High School's Gariel White, the previous world leader, while Archer went out hard and could not be caught, crossing the line at 50.88 seconds. Archer was nearly perfect in his execution and came off the final curve just ahead of Tarrant High's Jeremy Bemridge. He also took over the world lead from Qatar's Amour Ebed Abdulmujaid, who ran 51.74 seconds in South Africa on March 3. And that's the news on PBCJ. Thank you so much for watching.